Welcome to today's press briefing. On the stage, we have two doctors with us. Dr. Albert Au, Principal Medical and Health Officer, Communicable Disease Branch of CHP, and Dr. Larry Lee, Chief Manager of Hospital Authority. Dr. Au will give you an update on the COVID cases. Good afternoon, friends from the media, Hong Kong citizens. Let me report on COVID-19 cases as of the 28th of May. 108 PCR positive cases were recorded as of yesterday, including 21 reported by the HA, 19 by the Public Health Laboratory Service, and 68 cases reported by private laboratories, and also 129 RAT positive cases were recorded as of yesterday. And yesterday in total, we recorded 237 positive cases. Cumulatively, in the fifth wave, 1.199464 million positive cases have been recorded, including 749,318 PCR positive cases and 450,146 RAT positive cases. Among yesterday's cases, there are 37 imported cases, including 19 picked up at the Temporary Specimen Collection Center and 16 found during the quarantine period in designated quarantine hotels. 2 were picked up on the third day, 1 on the fourth day, and 13 on the fifth day. And yesterday, 2 cases were picked up at the community testing centers on the 12th day of the confinees of the quarantine. 1 involved a 68-year-old male who had 3 jabs. He has been asymptomatic. On the 16th of May, he arrived from Thailand. On the 23rd, after completing the quarantine, he left the hotel. And then on the 12th day, on the 27th of May, his specimen was found to be positive. He has a high CT value, that's 40. The other case is a 51-year-old male who also received 3 jabs, who is also asymptomatic. On the 16th of May, he arrived from Canada. And on the 23rd, after completing quarantine, he left the hotel. And then on the 12th day, that is on the 27th, the specimen was found to be positive with a high CT value 34. For the imported cases, 7 come from the US, 4 from Australia, 4 from Singapore, 3 from Canada, 3 from Zimbabwe, 3 from the UK, and 2 from the Netherlands, 2 from the Philippines, 2 from India, 1 from Canada, 1 from Thailand, 1 from New Zealand, 1 from Taiwan, and the other from UAE, and also 1 from Pakistan. And yesterday, we did not record any new case from residential care homes. As for schools, there is no new case reported because it's a school holiday. In the past week, 2 schools have been suspected to have outbreaks, including the St. Catherine's International Kindergarten in Kowloon Town involving 9 students and 1 staffer. And from the genome sequencing results on a preliminary basis, the cases test negative for L452R, meaning that they are Omicron strain prevailing in Hong Kong. The other is a DSC International School involving 4 students and 1 teacher. For the first case, the substrain is BA.2.12.1. And last week, a cluster was recorded in a secondary school involving 7 basketball playing students, and that's the Port Oi Hospital, Tang Pui King Memorial College in Hong Kong, as reported yesterday. So altogether, 104 cases have been recorded involving 98 schools. 84 involved students and 20 involved staff members. And on a daily basis, 780,000 students have RAT tests, and the rate is 0.011%. As for staff members, 125,000 teaching staff have received RAT tests, and the detection rate is 0.016%. So it remains at a low level. We have not recorded any death cases as of yesterday, and cumulatively in the 5th wave, we have by far recorded 9,163 death cases. Yesterday, we received one new case in an outbreak involving another bar in Central called Iron Ferries in Hollywood Road, Chinacam Hollywood Center, LG floor. So far, 11 cases have been identified, and they all went there between 9 p.m. on the 21st of May and 2 a.m. on the 22nd of May as patrons. They are 10 males and 1 male and 10 females, aged 24 to 39. 2 received 2 jabs and 6 received 3 jabs. And 9 of these cases are asymptomatic, and the onset dates are from the 23rd to 26th of May. According to the preliminary whole genome sequencing result, they are L452R negative, so they're believed to be the prevailing Omicron strain, which leads to the outbreak. And we've already issued a compulsory testing notice in relation to the premises last night and in the afternoon. Together with the FTHD and EMSD colleagues, we conducted a site visit to make investigation. In relation to updates on the previous outbreaks, yesterday we announced on the 4th floor of a California tower in Central, that is called Zentral, there are 4 new cases reported today. So altogether, 15 cases have been recorded involving 10 males and 5 females, aged between 17 and 29. They all visited the place between 11 p.m. the 21st of May and 2 a.m. the 22nd of May. In one of the cases, and according to information, the case only queued up outside without entering the restaurant and did not come in touch with other patrons in the restaurant. As for the 15 cases, all received vaccine jabs. 14 had mild symptoms. The onset dates are between the 20th and 26th of May. And among the 15 cases, according to our contact tracing and further investigation, 3 family members were subsequently found to be RAT positive. According to preliminary genome sequencing results, they test negative to L452R, meaning that they're Omicron strains. And yesterday, when we launched investigation in this restaurant, we collected 25 environmental samples, including bar tables, partition boards, air purifiers in different places in washrooms, the door handles, and also the air ventilation systems. 24 environmental samples tested negative. As for one remaining sample inside the toilet, the result is indeterminate, and the EMSD also conducted the air ventilation test, and now we're pending further analysis. And in one of the cases, he is a part-time basketball coach in the Yuen Long Tang Pui King Memorial College. And among the 30 students he taught, we have recorded one additional case. He tested positive by RAT yesterday. In the afternoon of the 24th of May, there were students receiving basketball training, and altogether 7 cases have been recorded. As for remaining students, we have arranged for them to be put under home quarantine. As for the cluster in Hong Kong Convention Exhibition Center staff canteen, we have not recorded any new case. For the dishwasher, the analysis shows that she is a BA.2.12.1 sublineage case. But the result would be further confirmed by whole genome sequencing tests.
As of now, cumulatively within this cluster, 2 arriving from the U.S. And they were in a cluster, and a total of 27 cases were involved, and 4 were the father and son from Nepal, and a couple from they were infected by the couple from the US, and 8 were patronizing McDonald's in Taikushing, and also a 65-year-old male. He was a close contact, and he was found to be infected on the 12th day, and 4 family members and also close contacts. So they were all close contacts of family members of the McDonald's patrons, and also 3 were working in Wenchai, a total of, and together with 1 other cleaning workers and also 2 family members, and also 5 were from the DSE International School related case. So this is all I'd like to say for the time being. Okay, from the HA, please, Dr. Lee. Good afternoon. Right now, a total of 427 confirmed patients are being hospitalized, and 4 are new cases. And for those who have to be admitted to isolation wards, 77 are in isolation wards, 11 are now in the secondary isolation wards, and 40 are now in the North Lantau Hong Kong Infection Control Center, and 17 are new cases. And yesterday, there was no newly reported critical or serious cases. And for those who are hospitalized, there are a total of 13 in critical condition, 8 are in serious condition, and out of the 13, 4 are now in ICU. During the last 24 hours, we do not have any death case, and a total of 45 patients have recovered, and 35 have been discharged. And since the onset of the 5th wave, we have a total of 50,148 who have recovered, and 49,794 have been discharged. And starting from 2020, we have a total of 62,528 patients who have recovered, and 62,174 have been discharged. And today, we have not recorded any patient who has been screened in. And for staff, a total of 23,222 have been confirmed, and 23,183 have already reported for duty. And I'd also like to say that at Tuen Mun Hospital, there is a ward for also dentists and so on. And yesterday, there was 2 staff who have been confirmed to have been infected. There are 2 nurses, and we are still doing tracing, and that ward has no longer admitted new cases, and they are undergoing disinfection. And in the next couple of days, appointments will also have to be rescheduled. And we are now carrying out tests for patients and also staff working in that ward. We are also collecting environmental samples for further testing. That's all I'd like to report today. Okay, it's now question and answer time. So before you ask questions, please introduce yourself and also the agency that you represent. Well, the lady in blue, I'm from TVB. I'd like to ask, for the newly added cases, is about the DSC International School is a new case involving a student. So is he in home quarantine, or is it a student from another class? And also there's a case. Is someone who just lining up outside Central. He did not enter the nightclub. So what's his condition? How many jabs has he had? And also what's his current condition? And I'd also like to know for the new case. So have you found out where the source was? Well, thank you for your question. For the DSE International School in Taikushing, we have not seen any new case. So it's kept at 4 students and 1 teacher. And one of the students was the first to have been infected. It was 24th of May, and he went to school on the 23rd of May. And for the rest of the students, they were tested positive on the 26th and 27th. And your question was also about Central, and according to what he told us, well, that night he did not enter the nightclub. He was just lining up outside, and there were many people around. And when he was queuing, there were other people who were entering the nightclub and the restaurant, and he has already received the vaccine. He already scanned the deform safe, but then in the end, he did not go in. We do not rule the possibility that he might be outside the entrance, and he might have contacted other patrons, and therefore he might have got infected. As to the latest spa that has new cases, well, on that night when patrons went there, mainly they were drinking and they were chatting, and most of them did not consume any food. So they would remove their mask there, and they would also be moving around, and some people would also dance there. And so there might have been very close contacts between people. And so it might have been through such contacts, and also there might have been some airborne virus. If there might have been a super spreader, then that might have polluted the air, and people might have got infected that way. But then we are still carrying out investigation. We have taken environmental samples, and the FEHD would also be looking at the ventilation system and other facilities before we can come to any conclusion. Okay, next, the lady at the back row. I'm from cable TV. I'd like to know, well, you've just updated the overseas travelers returning to Hong Kong, and that they would also have to undergo tests on the 9th day. So what are the reasons or scientific basis for choosing to do that on the 9th day? And you have already scrapped the PCR test certificate requirement. In other words, they would have to get a local laboratory to do the test before boarding the plane. So what about the more backward countries? If the test is not accurate, then that might increase the chance of people coming back and carrying the virus. And also there is another person in the school who got infected, and he was attending another class instead of the one. So are you concerned about the possible spread in that school? Thank you. With regard to overseas visitors, and after completing the 7-day quarantine at hotels, the current requirement is that they would only have to wait until the 12th day before they go to the community testing center for the PCR test. To add one additional test on the 9th day is to hope that if the incubation period for certain cases might be a bit longer, then by the time when he took the test on the 5th day and on the 7th day, if it's still negative, then on the 9th day, if we are able to increase or add in this additional test, then we would be able to identify these cases earlier. But then for the time being, we haven't found out such cases yet. And also at the quarantine hotel, during the quarantine period, if there is any spread, and in the latter period, for example, if somebody got infected after the 5th day, then probably on the 5th, on the 6th, and on the 7th day, the test might still be negative. And we will have to then wait till the 12th day before we can identify those cases. And if we are able to add in one more test in between, then we'd be able to identify those cases more early. So in the unfortunate event that somebody might have got infected in the latter part of the stay in the quarantine hotel, then we'd be able to identify those cases earlier. So for the people under quarantine, all right, on the 5th day, he would have to undergo the PCR test, and on the 6th and 7th day, he would still have to take the RAT test before he could leave the hotel. And normally, he would be leaving on the 8th day. And then if he were to take another test on the 9th day, then if it's still negative, then he would have to wait for 2 more days before he would have to take another test. In other words, he would still have to take the test on the 12th day, and for cases in which the incubation period might have been longer, and for those who have been infected during their stay in a quarantine hotel, we would still be able to identify them. And also on the PCR test that you refer to, well, for the time being, for people arriving in Hong Kong, well, once he arrives in Hong Kong, whether or not he has taken the test before boarding the plane elsewhere, he will still have to undergo the RAT test and PCR test when he arrives at the hotel. And therefore, that would not constitute additional risk to us, because all visitors arriving in Hong Kong would have to undergo this PCR test in order to confirm his status. And also about the basketball team. Now we found out that in this school, all the cases are concentrated on the PM of the 24th of May, when the students were undergoing training in the basketball class, and there were 29 students, and we have now identified 7 cases. And for the rest of the students, one has recently recovered, and for the rest of the students, we have already arranged for them to undergo home quarantine for 7 days, and they would only be able to go back to school by next Friday. So we would make sure that these students, well, given the fact that they are of higher risk because they have undergone the basketball training and there was this outbreak, and they would be classified as close contacts, and they would not be permitted to go back to school.
For other students, for the time being, since they have not attended the basketball training, we have not identified new cases, and we've asked the school to disinfect the premises thoroughly, and we will closely keep watch of the situation when school resumes tomorrow, the situation of other students. Next question, this reporter in white. I'm from Now TV. First, about the 2 bars with outbreaks. I'd like to know the number of patrons on the night in question and whether these 2 bars had any linked cases. And yesterday, it was mentioned that the last patron to leave the place was at 5 a.m. Did he not press the Leave Now button in Leave Home Safe, or was the bar contravening the regulation? As for passengers in transit or transfer, they are not required to conduct another test before boarding the flight. However, they shared the same flight with other passengers who would arrive in Hong Kong. Would this cause more risks? And is it difficult to differentiate between passengers in transit and arriving passengers? Yesterday, you mentioned a 44-year-old clerical staff working at the apron of the airport. Have you confirmed whether the case involves BA.4 or BA.5 strain? Is it the first case? Are you concerned whether there will be community transmission? Thank you for your questions. First, on the 2 bars, our preliminary investigation does not point to any linkage between the 2 pubs. In fact, the outbreaks in the 2 pubs occurred more or less at the same time in 2 different places. As for the cases involved, we have not identified any case having visited both pubs that night. And in fact, so far, we have not identified any case who've been to these 2 pubs, but of course, further investigation may be necessary. Our preliminary view is that on that night there were 2 outbreaks at these 2 different places, and we have asked the 2 operators to provide vaccine pass information to us, and from the information we gathered on the preliminary basis, at the relevant time periods, there were about 700 patrons for each pub. The actual figure will have to be verified. The second question, as mentioned yesterday, in the first pub, that is Zentral, a patron left at about 5 p.m. This is checked against the Leave Home Safe app, but upon further inquiry with the case, he left before 2 a.m. So apparently, the patron forgot to press the Leave Now button, and that used the lockout. He only used the auto lockout function after 4 hours. As for the question on risks, for passengers arriving from different places, they are all required to be tested at the airport, and they're also subject to quarantine. So for all arriving passengers, they share the same risks. And of course, there may be passengers on the same flight from different places, but then in terms of the level of risk is basically the same. So for inbound passengers, before they board the plane, they are required to observe the relevant testing and quarantine requirements, so that we'll be able to detect any possible imported cases. As for the case living in MOS town, believing to be BA.4, BA.5 strain, the analysis result is not ready. We only understand that this case may not be having the prevailing strain in Hong Kong, and this is a staffer in an airport office. He works near the apron, so he is of a high-risk group. But at the moment, we have not identified any direct contact between the case and any arriving passenger or air crew members. We will need to wait for the genome sequencing result to see whether we can connect this case with any local outbreaks. We believe that this worker might have been infected at work at the airport. And once the positive result was found, the case has been put under home quarantine and his family members have not been infected, and it's completed quarantine. How many patrons? Around 700. Next question, this gentleman. I'm from News. Good afternoon. Well, around 600,000 people have not received the third jab. That's what we know now. So some people are not actually in Hong Kong. So is there any way to exclude those who are not in Hong Kong at the moment to come up with the actual figure of those who have not received the third jab? And about the vaccine pass, it's come into effect for some time, and has the government reviewed the effectiveness and the enforcement details? And another question, the WHO is considering listing monkeypox as a healthcare emergency to bring it on a par with COVID-19. And then according to some LegCo members, the government should establish a mechanism as soon as possible to prevent the import of monkeypox cases into Hong Kong. What is your response? First question about the third jab. According to information, about half of our population have received the third jab, and of course there are some who have not yet met the criteria for the third jab, but to a certain extent we believe that there are some in the population who are eligible for the third jab, and it's time for them to do so, only that they haven't done so. So my appeal is for them to get jabbed as quickly as possible, because this will help effectively guard against COVID. And when the next wave arrives and wherein there is a surge of cases, and it is unsure whether this will happen. Perhaps a new strain may emerge. Rather than Omicron, there may be further mutation, and vaccination is in general effective in preventing deaths and serious cases. The second question is about the implementation of the vaccine pass requirement. I don't have information, so I'm afraid I cannot answer this question. And about monkeypox, the Center for Health Protection has been closely monitoring the outbreak of monkeypox in Europe and other countries. In early May, according to reports in the UK, some cases in the cluster which had no contact contracted monkeypox without having visited places with monkeypox outbreaks. And we are closely monitoring the situation. And according to the epidemiological information that we get from the WHO and the healthcare centers or the CDC in the US and Europe, some cases have had no history of visiting Central Africa or West Africa, and these cases mostly are male or close contacts of males, and in some cases there might be intimate contact with these cases. The transmission route for monkeypox is contact via contaminated or infected animals or objects, but for human-to-human transmission, it may be possible for transmission to take place for prolonged face-to-face contact or contact among family members. And we're concerned. Last week we wrote to all doctors and to hospital authority as well, and we've asked doctors to keep watch. If they find cases with possible suspected symptoms such as rash and bloating or bloated lymph nodes, and also cases with travel histories to Central or Western Africa, as well as countries where there are monkeypox outbreaks, and countries in which monkeypox isn't an endemic. And if these cases have come into contact with suspected cases or have really intimate contact with other males, and if these cases exhibit relevant symptoms, the cases should be reported to us. The public health laboratory service has the capacity to check for these viruses, check for the monkeypox cases, and we will step up our capacity, and we're also preparing a responsive plan with other government departments, and should there be an outbreak, we have a system to cope with the situation.
And our current quarantine and isolation facilities should be adequate, and therefore we should be able to cope. Next, English question, last row.
View TV News. Could the CHP explain the reasons behind requiring an additional PCR test for inbound travelers, and what's the purpose of setting it on the 9th day of arrival? And second question is about the new bar cluster on Hollywood Road. Could you tell us more about how the virus spread among the 11 customers? Thank you.
Thank you for your question. For the first question on the testing requirement for inbound travelers, previously, after quarantine in designated quarantine hotels for 7 days, inbound travelers are required to have a PCR testing on day 12. But however, some of the cases they might have a longer incubation period, so that the virus might not be detected or during the quarantine, or they might have onset after completion of the quarantine. This is a theoretical risk. So adding another PCR test earlier between day 5 and day 12 will increase the chance of picking up these cases at an earlier period. Secondly, designated quarantine hotel is not risk-free. Our experience show that there might be rare chances of transmission of COVID-19 within the designated quarantine hotels. So in case if an inbound traveler get infected during their quarantine in the designated quarantine hotel, especially in the later part of the quarantine period, they may not be picked up before the completion of quarantine. So adding a day-night testing will increase or enable us to detect these cases at an earlier stage to prevent further community spread. For the second question on the mode of transmission of the outbreak in the Ion Ferrari Spa, we are still investigating. According to the information provided by the cases, they have mask-off activities inside the bar. Some of them, they have dancing activity, and also they drink alcohol. So we suspected that there may be a super spreader or an infectious person who had entered this bar on that night and causing the spread and also the outbreak. At this moment, the earliest case had onset of disease on the 23rd of May, but however, we suspected that some of the cases might not be reported to us yet, or they have not been tested yet. So we will see whether there will be further cases after the issue of the compulsory testing order.
Next, the gentleman in white. I'm from AM 730. With regard to the pub in Central yesterday, well, you said that there was someone who was queuing up without going in, and for how long did he stay there? And also, how close was he from the main entrance to the pub? And did he go to other pubs that night? Because both yesterday and today, you announced that a total of some 700 patrons had been there. So would that be in line with the capacity of those premises, or is it that 700 went in and out during that period of time? And also for the two staff working at the hospital, so did they dine together or did they have meals together? And for that particular ward, how many patients were there? And thirdly, according to government's announcement, with regard to overseas arrivals, all right, for overseas laboratories doing the PCR test, they would be recognized without being listed on the authorized or accredited labs. So will you just recognize the laboratory test results, or is it that they had difficulty identifying authorized or accredited labs? Why is it that you're relaxing that requirement? Well, I'll try to answer your questions, and then I'll ask Dr. Lee to give you more details about the Truman Hospital cluster. Well, for the pub that was announced yesterday, we managed to locate some 15 persons, and some told us that, one said that he did not go in. He was trying to patronize that restaurant, but then when he found out that there were many people who were queuing up, and he scanned the Leave Home Safe app, but then he did not go in the end. And then for the other patrons, according to what they told us, in fact, there were many people there that night, and probably within the premises, there might have been over 100 people there at the same time. And then for the 700 figure, well, we tried to check the Leave Home Safe app, and then we got that figure. So during the same period of time, from 11 p.m. to 2 a.m. the next morning, and then another bar was from 7 p.m. to 2 a.m. the next morning. So those were the total number of people getting in. So they might have been in and out, and therefore, so a total of 700 people might have been there, but then we would also have to find out whether or not there might have been duplications and so on. But according to those patrons, they said that there might have been several hundred people within more or less the same period of time in the premises. And they would not be surprised if there were several hundred at the same time. So we will have to do further investigation. Next is about the arrivals coming to Hong Kong. Well, for the pre-arrival test, that's only one of the requirements or methods to make sure that, well, for the known positive cases, they won't be boarding the plane and coming to Hong Kong. But then other than that, we have also put in place other measures, and one of the other relaxations, as has been reported by the FHB, well, that's to facilitate Hong Kong residents coming back to Hong Kong, and also to provide convenience to them, whatever the reason. Well, by the time when they arrive in Hong Kong, well, in Hong Kong, we also arrange for raw arrivals to undergo the RAT test as well as the PCR test at the airport. And that's done by recognized or accredited laboratories in Hong Kong. And once they are detected positive, they would also have to go into the relevant facilities. And for those who are tested negative, they will still have to go into quarantine hotels. And then for the nurses, they are actually working at 11B at the rehabilitation block at the Truman Hospital. Initially, we have not found that they had any further contacts or had been eating together. And yesterday, they were found positive, and the CT value was low, below 20, and a total of 20 patients were in the ward, and they are now undergoing tests, and we are still waiting for the result. And according to our initial assessment, no patient or staff member have been listed as close contact. Next, that gentleman here. Well, good afternoon, doctors. I'm from Ming Pao Daily. Well, for the two pubs, I'd like to know more about that. According to the CHP's investigation, so between the two pubs, have they breached any rules at all? So other than the time duration, so during that period of time, according to what you said, they might have engaged in dancing, and some DJ doing performances live there. So have they breached any licensing conditions and so on? So will the pubs have to face any consequences? And also on the school. First, for the Port Oil Hospital Memorial College involved in the basketball training class. So is there a need for them to suspend classes or take other measures? And also for the Kowloon Tong International Kindergarten. Well, according to what you have found out so far, there were several cases. So between those cases, how did they transfer or get transmitted? And also, would they be able to resume classes tomorrow, both the AM class and also the afternoon class? And also for the pubs, if there are several hundred patrons at those places during the same period of time, they might have been gathering, and there might have been cases. So what's the risk of the transmission? And also, if there are several hundred people gathering together on the same location, is that safe? Is it appropriate? Thank you.
多謝你嘅問題。
Thank you for your questions. About whether the bars have breached CAP 599F and other regulations. I think the relevant departments, especially the enforcement departments, will collect more information for further assessment. So I am not here to draw a conclusion or pass any judgment. In relation to the 2 bars that night, we have obtained information from the vaccine pass information that many patients visited the 2 bars, and if it's as many as 700 patients, we believe that the risk is high, and it's been a week from the outbreak, and a lot of patients have had onset dates as the 24th and 25th of May, and these patients got tested, but many others did not. So we issued compulsory testing notices in relation to these 2 premises, and for those who visited these 2 places, we urge them to conduct PCR tests or conduct RAT tests as quickly as possible and report any positive case to us so that we can arrange for isolation and for the family members to be put under quarantine. And depending on the outcome of the compulsory testing notice operations, we don't rule out requiring the patrons who visited these 2 premises in subsequent nights, and that we'll be able to identify more cases. For the secondary school, the Temple King Memorial College, last Thursday, it came to their notice that the basketball coach, the male basketball coach, tested positive, and then the school arranged for 29 students to undergo RAT tests again upon their arrival in school, and later they identified a handful of cases. As for other students, they tested RAT positive at home, so they didn't go to school. So as far as we know, for these 7 students who tested positive, they had not gone to school afterwards. So the risk of having transmission in the campus is low. And for these students, they had contact with the male basketball coach in the afternoon of the 24th of May. And on a preliminary basis, we believe that there could be transmission during basketball training that afternoon. We, however, need to check whether these cases belong to the same mutant strain. For the 29 students, whilst in class they did not wear a mask, and usually in the school we won't list other students as close contacts. But due to this special case, when there is an outbreak, other students who also attended basketball training would be listed as close contacts, and they will be subject to quarantine. As for other students in the same class who did not attend basketball training, we don't believe there is any exposure to the virus, but we want to make sure that each student who goes to school will have ready an RAT negative result first, and if there is further outbreak, there will be further investigation. There is no need at this moment to suspend classes for the school. The last question relates to the St. Catherine's International School. The outbreak took place last week, and so far we have identified 1 cluster involving 6 students and 1 teacher in one of the classrooms in that kindergartens. And for other cases, we have identified 1 case in each of the classrooms respectively, and we will keep watch of the situation and see whether there are any further cases relating to other classrooms in the kindergartens. Any other reporters who would like to ask questions? If not, that's the end of today's press briefing. Thank you.